I had no idea what I was dealing with, and I was terrified. One of the first things I did was go to the internet. Don't do chemotherapy, don't do radiation, don't get surgery, just don't eat.
I am worried about disinformation and lack of knowledge. Someone saying that they know how to treat the cancer as well as the medical oncologist is very dangerous, and I think we're getting close to that in current society.
So today I'm with Dr. Marc Cohen, who is the Associate Chief Medical Officer at Memorial Sloan Kettering Cancer Center. You are a practicing head and neck tumor surgeon. You are also been voted one of Castle Connolly's top practicing U.S. physicians 5 years in a row, 2025 being one of them. It's a title only awarded to 7% of all doctors, essentially making you one of the best doctors in the country, something I can personally attest to. Other accolades include the Robert Maxwell Byers Award for Most Influential Clinical Manuscript at the American Head and Neck Society meeting 2010, Malcolm Shivey Award for Excellence in Teaching, the James Moore Clinical Scholar Award. You're featured in New York Magazine several times as a top doctor, and you just so happen to be my personal hero and the person who saved my life. So thank you so much for taking time out of your very busy life to have this interview with me. This means more to me than I think you can really begin to imagine. It's not every day we get to talk to someone who's a hero in our life. And like I was explaining to you before, for you, it's like we're normal people or you're a normal person. But for me, you're not a normal person. You're a magical human being. I guess if things went differently, I would probably not think this way, but you did efficiently save my life. So I just want to say, number one, the way that I met you was that you are my cancer doctor. I mean, you're my cancer surgeon. The first time I met you was in 2020 after I woke up from surgery that an ENT had told me that I had a nose polyp. It was not a nose polyp. It was a rare tumor, an olfactory neuroblastoma, I believe is what it's called. And I needed skull-based surgery. The ENT who performed my original surgery had a guy who could do the surgery, but luckily I was introduced to you. My question to you is, how did you get into becoming an ENT, which is also an otolaryngologist, right?
Yeah, that's correct. So first of all, thank you. That's very, very, very kind. It means so much to me. My number one professional sort of aspiration is to care for patients and to let the cancer patients know that I'm there for them and I want the best for them and their families. To be honest, it's humbling and actually somewhat makes me feel a little bit awkward getting spoken about in those ways. So, but thank you. It's very, very kind of you to speak that way. The first question was, how did I decide to get into otolaryngology or ENT? I think going through training as a medical student, there was a lot of different possibilities, a lot of different paths that I thought would be interesting or exciting and professionally fulfilling. And then, I happened to be there for a lecture that two of my mentors, or they're still my mentors now, when I was, I don't know, 22 or 23 years old, gave a lecture on someone or a disease that had invaded the jaw, the mandible, and showed the pictures of this really, really radical operation where they had taken out a cancer from the mandible or the jaw, and what was involved with that, and how they removed such a large portion of the anatomy that could have potential major ramifications of structure and function on patients. And the second half of the lecture was on the reconstruction and how they put that person back together. And they showed pictures and they went over the case. And these two mentors of mine basically showed the outcome of this patient and how the patient looked 5 years out. And you would never even known they had surgery. So this idea that you can meet someone and you can interact with someone and be there with someone in their darkest times and take them on this journey and try to help them and cure them or help to treat them of their cancer, but also get them back to the life they were before. Something that was really, really appealing. Now, why ENT specifically as compared to, say, another surgical oncology field? The head and neck is such major importance It's so intricate. It's so important in terms of how you see the world and how the world sees you. That's just sort of what one of the fields that I became interested in, and found my people in that field, and kind of went down a path that could have gone a bunch of different ways. So that's sort of, I went into the field of ENT knowing that I wanted to do cancer, which is kind of a small subset of what most ENTs do. Um,
Why cancer? Why specifically targeting cancer? Was there a
um,
reason or just
that's a great question. It just, to me, it was something that it like boggled my mind what could be done. I thought that it was something that would be professionally very fulfilling, intricate, and challenging. And also, having seen family members go through a cancer journey, and it was something that I wanted to dedicate my life to.
Well, thank God I was lucky enough to run into you when I was going through what I was going through, and the thing that was scary, the most scary, was when the doctor who performed my original surgery was speaking to me about what the next steps would look like, and the next steps basically looked like removing my face and my head, a part of my head and skull, to get to that tumor. You had a way of doing it without having to do any of that. Um, can you tell me what made the difference there?
Sure. I mean, you've always been very open. So for the listeners, you had something called anesthesioneuroblastoma, which is a very rare cancer type that you see in the paranasal sinuses, or the sinonasal space, um, and the skull base. Traditionally, and actually we still do it today, for a lot of cancers in this area, we need to do an incision on the face to access the tumor, and an incision on the head, and do a craniotomy to get the tumor out. And we still do that today for certain cancers, depending on
You still
the
do that
yeah,
surgery?
I do with a neurosurgical partner. But things have advanced, technologies advanced, and for certain types of cancer, like the one that you had, you can do them entirely through the nose or endoscopically. So you do them in such a way that no one would have any knowledge or idea that you had surgery for your cancer.
Do you make that decision on how you're
Sure.
going to do the surgery?
Yeah, so it's first of all, every patient gets presented at a tumor board. I'm part of a really wonderful team of radiation oncologist and medical oncologist, and other surgeons and radiologists, and just a wide variety of members of people on the team. I wouldn't say that I make the decision, but there are sort of certain indications and contraindications for different types of surgical approaches. Like if the tumor was through the skin, then you can't do it with an endoscope. You have to make a cut on the face. Or if it's into the eye, then you can't do it a certain way. So just the way your tumor was, you were actually a little bit fortunate, even though I wouldn't say that you were fortunate getting the cancer, but you were a little fortunate compared to others that were able to do it entirely through the nose with me and my neurosurgical partner, Dr. Tabar.
So how did you because that was a transition. For originally the surgery that you had to do was only done that way, and endoscopically is something that came after the fact.
Yeah. So it actually, the transition kind of happened in the sort of mid 2000s, like probably on the order of 2005 to 2009. This was not my work. I finished training in 2011. So there were other people that had sort of,
Pioneered.
pioneered and were on the shoulders of giants, as you say, and had shown that it's safe and effective to do it this way.
So you learned how to
So
do
I
it that
learned how
way.
to do it that way. So I
How
learned doing it the big way, and making the big cuts, and I learned doing it with a camera, which is also a big way. You just don't see the cuts, and the recovery is shorter.
How do you actually learn to focus? My surgery was it a hard surgery to do? Was it an intricate surgery?
Yeah, yeah. I mean, these are all very challenging surgeries because you want to make sure that you're getting margins that are negative, and you're getting all the tumor, and you're giving the patient every opportunity to beat the cancer, and also to avoid sort of side effects or long-term morbidities of the operation related to the brain or the eye, or something along those lines. You ask a great question of how to learn an operation. I think
Yeah.
that's sort of a big philosophical question that we ask for all surgical procedures. I think that's why surgical training is so long, because you start out and you watch and you learn and you read, and you watch, and then you do a little bit, and then you watch and you read more. And over the course of 6 or 7 years, you become someone who's let out into the world and passes the board exam and does these operations kind of as the primary person. And then even after you're let out into the world, there is still a learning curve as you grow, like any other job or any other skill. As you grow and change and age, you get more knowledge and you become better at it.
Did you feel confident when you first were like kind of let out into the world, as you're saying? Were you confident in the beginning?
Yeah, I think I was lucky in that I've always had mentors and colleagues that, for really complicated things, I would have help me. Or, I have, I think everyone has an ego, but I think my ego as a surgeon is pretty tame, and that I always will ask someone to come and help, depending on sort of comfort level, and the complexity of the operation, which is one of the things that I try to teach the residents and the fellows, is that, at the end of the day, the patient is what's most important, and it's never the wrong thing to call for help.
Well, I just want to say that the biggest benefit for this interview for me, and why it means so much that you were willing to do this, is that when I first found out that I was dealing with cancer, one of the first things I did was go to the internet. I went to YouTube and I was looking for anything I could get my hands on that basically would give me an idea of what I was about to get myself into.
Sure.
And as I was saying to you before we started, there's really not much. I mean, finding, especially someone like yourself who's a top surgeon, like you said, your ego is very high. Like, there's no question your humility is high, but you are who you are. You are doing very difficult surgeries, and people are putting their lives in your hand, which is a responsibility that I don't think many people are signing up for. Also, like we were saying before, things happen. Things don't go the best as they could, and they need a scapegoat needs to be made, and that could be you in those situations. So, the bravery that it takes to actually be like, okay, I'm about to drill through this guy's skull and remove a tumor that's in an auspicious place. I don't think that there's a lot of people signing up to do those kinds of jobs, nor do I think that people are capable of doing those things unless it's something in your heart to do. But my point is that when I was first figuring out what I was going to do, and they were telling me they were going to have to remove a piece of my face, I was very lucky to have a friend that introduced me to you. And once I got in front of you, I had no idea what I was dealing with, and I was terrified, and I was looking for anything that could tell me what I was about to get myself into. And like I'm saying, there's really nothing out there. There's not top cancer surgeons doing interviews with people out there. I don't know if there's a particular reason for that, or why there are people trying to keep it close to the vest, or people worried about doing those kinds of interviews. I was very surprised that you were willing to do this with me.
Yeah, no, I that's a great question. And again, and I don't think it's necessarily cancer only. I think part of it is that it's rare. It's a rare tumor type, that you have, so it's just not that not that much press or not much sort of knowledge about the cancer type. I mean, what I'd say is that, you don't know a ton about me, but having a child with significant medical issues myself, I would say even I have a hard time navigating. He has a really rare condition, and it's not always easy for me to get the resources, whereas I'm pretty plugged in. I have people in a bunch of different medical centers. It's not always so easy for me to get the knowledge that I wish I had. And I don't know exactly why that is. I mean, I think it's a great, again, a bit of a philosophical question, with respect to knowledge, and cancer care and health in general. Is how come we haven't come to a place where the knowledge isn't more accessible, and there's not a place where people can get answers to their questions when they have them at 2 o'clock in the morning, and or 10 o'clock or 5 o'clock. And the only way to get answers to those questions is to put a call out to a physician's office, and they may or may not get back to you in that day or the next day or the following day. So I don't exactly know why that is in healthcare. I think taking a step back is probably that way in most fields. You
Well,
could, maybe you could say that about, like, when your car breaks down. It may be similar in nature. Although I wouldn't equate a car with your health. I think it's an interesting question that I haven't really thought about until
Well, I think it's also something that kind of needs to be addressed because what's the alternative, which is going to be holistic approaches and holistic
Sure.
doctors on YouTube telling you, hey, don't do chemotherapy, don't do radiation, don't get surgery, just don't eat,
Yeah.
fast.
Yeah, we are in a world now where I am worried about disinformation and lack of knowledge and kind of destroying the barriers of credentials, right? Of someone saying that they know how to treat the cancer as well as the medical oncologist is very dangerous, and I think we're getting close to that in current society.
It's happening.
Yeah,
Actually, when I was going through treatment, one of the things that I did, you run into other people, right? You're sitting in the room waiting to get your radiation, and there's another person in the room. You start talking, and it wasn't uncommon that I ran into people who either themselves or had family members who went a more holistic
sure.
way, and it backfired
Yeah.
horribly. I never heard someone saying, "Hey, I went holistic and it worked out for me."
So and I've seen those people, and it's devastating when you have young, healthy people that go a different route, and things that were treatable become untreatable. I mean, that's unfortunately part of the challenges that we have as healthcare providers. I guess what I'd push back on and what I relay to you and to the listeners are, if you have a problem like this, there
Cancer.
cancer or anything that's challenging, find yourself a doctor that answers your questions or the team that answers your questions. And it never hurts to ask as many questions as you want. And there's a plenty of doctors out there that will answer them if the doctor that you're seeing won't. I think you kind of said it before, part of your own thing was you were scared to ask some questions, you were scared to reach out. I think the moral of the story is my recommendation would be, don't be scared. Reach out, ask, and if you're not getting what you want, go to someone else who may know what you want.
Yeah. Well, that leads me into my next thing, which is that I think it's so important if you are going through something like this, like a cancer, that you need to find your doctor.
Yeah,
And being a cancer survivor, I do talk to a lot of people who are currently going through cancer. I don't know, it just works that way.
yeah, for sure.
It just works that way where you just run it like everyone brings their cancer story to your door.
Well, you're a magnetic guy
Thank you.
and you're open and you're honest, so that's not surprising in any way.
Yeah. Which
I mean,
uh,
that's also part of why I do love working here at MSK, because all we
yeah.
do is cancer. And I have colleagues that, in my opinion, are those people also that are willing to answer any question and be there for patients and do everything for patients. And that's what I love to do.
Well, my point here too also is that you need to find the person that makes sense to you
Yeah,
because again, I say this to people all the time. You got to find your doctor, and you have to trust your doctor unequivocally. If you're not going to trust your doctor, it's the wrong doctor. If your doctor says something to you and you're doubting what your doctor is saying, you're with the wrong doctor. That's my personal opinion. And when I was looking for the person who was going to do the second part of my surgery, well, actually to do the surgery, I called up several different people. I talked to doctors at different hospitals, and it just, I'm the type of person, something's got to click for
yeah,
me. It either clicks or it doesn't. And anyway, eventually, when I wound up in your office, I showed up and I was in a terrified place. I didn't know what to expect. I hadn't gotten any scans. I didn't know if the cancer had spread to other places. Am I going to die? Again, also no information out there to really help you. And until you get scans done and everything done, you can't really get a proper diagnosis anyway. So when I showed up in your office and I sat down with you, there were so many things that happened. I'm a very spiritual person, I would say, and so there were so many things that happened on the way to this interview that I guess I was having with you, right? Because I also have to decide, are you my guy?
sure.
Right? I'm not the type of person that's just going to be like, okay, this is the doctor that was recommended. I'm just going to do it. No, it was also, I was there for an interview as well to see if you were going to make sense for me. And the one thing that you said to me, and I just want to read it off my paper because I wrote it, I think, beautifully. My first visit with you was surreal. I had no idea what I was really dealing with and what the final outcome would be. But in our conversation, you said the most perfect thing, the exact thing that I needed to hear. And this immediately ensured me that you were my doctor. And what you said to me is, I will get this out of you. That's what you told me. Dude, I'm sorry, I'm going to cry.
It's okay. Thank you for sharing that.
Yeah. Why would you say, first of all, how do you say something like that? Like, how, like, I don't know, it just with you, and now I'm going to get a little bit more, I guess, personal
Sure.
about it, because with you, it's not like something I experienced with anybody else in my life. Like for you to say something like that, I just wonder, like, I know you don't remember, but that's what you said. You said, I will get this out of you. How do you know that? Like, and am I overthinking that or overlooking that, or is it just as simple as?
No, I don't know. I mean, I think that in my own, life and my own experience, the physicians that I've really been drawn to, either personally or professionally or mentors, are those that have a relationship with patients, and they're able to be humble and honest and thoughtful, and also relay confidence and to help patients feel like they're on the right path.
But that's a statement.
And I wouldn't say that if I didn't feel comfortable or confident that I would do that. And I don't know why in that moment I would have used those words. I don't recall that specific.
No, that I recall it like it was yesterday, But like I said, when you're going through
Sure.
something like that, it's all surreal and you remember it vividly. But I was just, again, I thought that was a statement that was the exact
I
thing
think it's
I needed.
I think it's having experience and confidence in knowing how to care for the patient's cancer and to care for the patient.
You had only met me like 2 minutes in, and is that something that you would just like? Is that a blanket statement for you, or was
No,
that's just kind of your
I
intuition in when you meet
intuition
with a
or
new
talking
patient?
to you and looking at the scans and seeing where the patient is, but that's not something that I routinely.
Well, when you first met me, you were looking at a very basic scan, right? It was a
Yeah,
CT scan.
yeah,
It didn't have contrast. It
yeah.
was just like an X-ray kind of, right? So how was it? Because you also mentioned to me that if you would have seen that scan, you would have known that there was a tumor. So how does that, how do you determine that versus a regular ENT who wasn't able to determine that?
Yeah, I mean, this is kind of all that I do, right? So if it's all that I do, and it's the cases that I see, I could see a scan that doesn't have contrast, but is eroding the bone or is only on one side of the nose. Like there are different kind of tells
Right.
from a scan that could kind of give us the idea of what the right move is, and it really isn't one size fits all. Meaning every every patient and every patient's cancer is different, and some different types of cancer are treated in different ways, and some are treated with different types of surgery. And really, it's a matter of kind of just experience and doing this as my only thing that I do, and working in an amazing team that I
Mm.
felt comfortable to relay those words to you. That it's not, again, it's not as if I relay words like that to everybody all the time. I see a lot of really challenging cases, and some of them, you come in with humility and are honest with patients and do everything you can to get them to the best place.
When you first meet a patient,
Yeah.
and one of the things that I thought about you anyway, and I still think about you, is that you're extremely intuitive. And I think that that's one of the requirements to have a good doctor. I remember my childhood physician, he would just look at you and tell you what was wrong with you. And I think you have that kind of intuition. Are you typically able to know what you're getting into from the onset?
From the cancer's perspective, or just talking to people in general?
No, no, no. I
Because if you
mean,
ask my wife, probably not.
no,
But
yeah, well, okay. That's No, I think that like when you meet a new patient
yeah.
and you're reviewing the whatever information you might have, are you already kind of in your head? knowing where this is going?
Yeah, I think so. I think before you meet a patient and you have scans and biopsy and a story, I think that with experience you kind of get an awareness of what's happening, and the more that you do, the greater your confidence is, and sort of the ability to read patients and to help them get through the journey.
Because I will say that, and again, I don't think it's a common thing, but you kind of before even the testing was done and everything like that, you already kind of knew what the results were going to be at several points throughout my process, and you weren't afraid to relay that to me, which brought me great comfort. Of course, you're still scared out of your mind, but to
Of
hear
course.
your doctor tell you, "Hey, you're going to be fine," which is also another thing you had said to me at one point. I asked you, what do I tell people? And you were like, "Tell them you're going to be fine." You also said things to me like, "I cured your cancer." There was one interaction I had with you. I mean, again, it's been over 5 years, so I've
We cured your cancer, not I usually, but okay.
no, I
Because
mean,
I do see myself as part of a big team,
yeah.
a very large team.
Of course, well, maybe you did say we
Yeah.
at the time, but what I do remember is basically we were talking about how I was doing and how are you feeling and da da da, and I think I had said something to the degree where I was like, well, like I was like, you got to be like a fish, and you had said that to me actually prior to like which again I know is a crazy thing, but you did talk to me on my level, and you did talk to me in my lingo, which I think I'm also a very complicated person. So I think that for me, I was very impressed with the fact that you were able to connect to me on my level and talk to me in my language, which is something that I don't experience very common in my life. But my point is that it seemed like throughout the whole process, you already knew from the beginning the results and were kind of hinting at that to me without saying it bluntly. So I guess the question is the harder question when you run into a situation where you don't see a good outcome coming down the pipeline, how do you address something like that with someone who you're sitting in front of? They don't know it yet, but you kind of already know you are in bad shape.
Yeah,
How do you do that? And does that affect you like on an emotional level? Like you don't know the person, you just met this person.
definitely. Definitely. I mean, I think these are hard questions that I think about a lot, actually. But so, in answer to the second part first, because that's the easier part to answer, definitely affects me. Definitely affects me. Definitely affects my life and my world, and um, definitely bring that home a bit, probably too much, um, because so much of my time and effort is spent in this pursuit, the pursuit of taking care of patients, of caring for them, of researching, of trying to figure out a better way to treat people with this cancer in this area. I mean, this is what we do is we just think about how can we make the cancer cures better, and how can we make the quality of life for patients going through them better, and how do we figure out the best ways to figure out what matters most to patients. I think that's kind of the next piece. I'm going a bit off the tangent, but the next sort of piece is evolving from a binary. Is the patient going to be free of cancer in 5 years, or yes or no? That's sort of the old school thing that mattered most. And then after that, it's the binary. Well, is the patient able to see in 5 years or not? So things that are big, very sort of big and important to the physician. And I think the future, and what one of my partners specifically is, she's really, really working on very hard, is how do we best figure out what's most important to patients? What is most important to patients? Because to a doctor, it's cure for cancer, right? But to a patient, sometimes it's not always so easy. Sometimes patients have different perspective on what's important and what's not. That as physicians don't check a box of yes cancer, no cancer.
Are you
Like
talking more
sense
about
of
like quality
smell,
of life?
sense of smell, taste, ability to speak, ability to eat. Like
Well, I will say
these
that
things that as physicians we care about for sure, but we don't have a true finger on the pulse of what they mean to patients. And many years removed from a surgery, it's hard for us to keep a finger on. So I think that is kind of the future of figuring out how best to care for patients is figuring out what matters most to the patients and delivering to them the choices along the cancer journey with that in mind.
And does that mean like not pushing the agenda that the team might have?
Yeah, that means partially that. It's, if for instance, if there is a treatment that if you undertook this treatment, there's a 5% chance of less chance of cancer recurrence, right? Or 10% chance less of cancer recurrence, but it impairs your sensation, or it impairs your ability to eat or drink, or it does some other functional impairment. Really, the patient should be the one
That makes that.
to make the decision, but patients often aren't equipped with that information. And there really isn't great research into how best to measure that and what do those things look like. So I think that's kind of the future piece of it. Um, so that was the second question was, do I bring it home? Yes, I bring it home, and it impacts me significantly because so much of my existence is thinking about these things and caring for cancer patients. That when a patient has a bad outcome, um, or when I know they're going to have a bad outcome, does that bother me? Certainly. The first part of your question was, how do I engage with those patients? I think
Yeah,
that was the
well,
how do I frame it with those patients? I think that was the first part, and I
well,
guess to that I'd say the most critical part is being open and honest with people, and saying X, Y, or Z is your diagnosis. Um, this does not traditionally have as good of an outcome as other types of diagnosis, but here is what we are going to do to give us the best chance to win. To be honest and tell it like it is, because you always have to tell it like it is. That's what my job is to tell it like it is, but also to educate and to give the information that they need so that there can be hope.
I mean, it has to be. I guess my opinion of doctors is very skewed, and I think that a lot of people, including myself, make blanketed statements that doctors suck or things like that. I mean, it's true. Most people who are out there who are not doctors or who are trying to get medical care, it's not uncommon for people to think that doctors are terrible at their jobs. And that has been part of my experience, outside of meeting someone like yourself and some of the people at Sloan who are just absolutely on another level. But that kind of care isn't just like waiting for you at the urgent care. And so I guess what I was saying is that you're having the most difficult conversations with a person that they're going to ever have with someone kind of in their life.
Yep.
Um, and like the fact that you decide to sign up for that every single day and have to deliver diagnosis. I mean, I was really going to get into this with you because I feel like like I said, when I met you, I had no idea what I was getting into. You essentially diagnosed me. Of course, I received a diagnosis before that, but you were the one that pretty much told me what I was looking at. When you have a patient and you're already looking at it like, there's like, how do you tell somebody that? Like, how do you say, hey, like, I just don't know how to connect those two dots where you have to be the one that has, especially someone like you who's so warm and welcoming and is like, in my opinion, I don't think it's an act. I mean, I would like to think to some degree, I'm like, is it an act? Is he really this good of like this kind? And, but I don't think that it is. I think you're a genuine human being that really gives a shit about people on a deep level. And so I was like, really, one of my biggest questions was how are you doing this? And what tools have you gained over the years where when I want to tell you something really quick. One of my appointments, so essentially after your cancer is cured or removed or you've gone through treatment, you're going to have follow up. you know I've been doing 5 years,
Yeah.
MRIs,
Yeah.
scoping me. But in one of my appointments with you, it's like follow up. um, I was sitting outside waiting to get called in, and there was a young person, probably around my age at that time. He was with, I think it's like his girlfriend, and maybe his mother, and he was sitting out there, and I saw the leg, the leg bounce, and they came out and they called him, and they were like, "Oh, Dr. Cohen's ready to see you." And I went up to him And I was like, it was like, Mark saved my life, man. And I was like, if you got a chance, Mark's your chance. I had that conversation with this guy, and you could see it. He was a big guy too, like big, tough, tattoo kind of looking guy. And you could see the terror and the fear. And I know that terror. I know that. I remember sitting outside waiting to meet with you with my leg going like that. Um, I don't know how you do it, man.
Well, thank you. I mean, it means a lot.
I wish someone would have said that
I
to me when I
think.
was sitting out there. Hey, the doctor you're about to see saved my life.
Well, thank
I
you.
mean, think about the comfort also to some degree, because I know that that's something that I would have liked to hear.
Um, Thank you. I mean, it means a lot. I think that I real. I kind of live this way. So I think that I'm getting emotional too. Um, yeah, thank you. I mean, I one of the things that I hope that we can relay to listeners and to you is that doctors don't all suck. That some doctors are really good. In fact, I think most, if not all, try their hardest to be really good. I think the system is sometimes challenging for many doctors, but I think by and large, physicians go into the field for noble reasons, and try their best. And and I hope that perhaps the team here can kind of give you um, that feeling that there are good ones out there, despite your experience with maybe one or two that weren't good, or other people's experience. And because as we sort of talked about before, one of the things I do worry about is the erosion of trust between patients and physicians, and what that leads to when there's no trust, and there's an erosion of credentials, as we said before, that leads to patients not doing as well, and that leads to T1 tumors becoming T4 tumors, which doesn't really benefit anybody. So thank you, I guess, is all I'd say. And hopefully we can figure out a way to to restore trust, and to ensure that we're caring for patients.
Yeah, I mean, I think there's a lot of idiosyncrasies, and I think that there's a lot of intricacies involved in the way people view doctors. Now, like I was saying to you before, it's like the police. Like when you're a civilian, you don't look at the police as if they're going to protect and serve you. You look at them as if however you look at them. And I think people look at doctors kind of in a similar authoritative way. Like I was saying to you, like getting to know you, or you giving me that entrance into like knowing you on like a little bit more than just as a doctor patient
Sure.
kind of thing. But even like you say, hey friend, or you like every time I see you, you're like, hey friend. And it's like, I don't know, it's just it's a different level and it's a different vibe. But I have to come here because it was my major question.
Sure. Please.
How do you deliver diagnosis? Like, what is that? I just would love to know, what is that like? Because when I think about if I was in that position and I had to do that, I don't think I can. I don't know if I can handle that personally, or how. I think that's the most difficult part. I try to find somebody else to do it for me.
um I think that I don't have a good answer to the question. I really don't. I mean, there's certainly times where I'm walking into a room and I know the diagnosis is not great, and I dread doing that. And you do it. You tell the patient what the diagnosis is, and you give the patients all the information that you have, and you tell them all the ways that you're going to support them, whether that be through treatment, or socially, or psychologically, and you give the resources that you need to give. I think that's part of the job. Some of the most meaningful and most impactful and most influential interactions I've had with anybody, with patients, were patients of mine that I've lost, that I became close with, that I went to their funerals, that those people mean so much to me, and their families mean so much to me. And it's it's devastating when you lose someone, especially when they're young. But then to have their family relay, this patient loved you so much, you gave them so much comfort in their hard times, makes it worthwhile.
Yeah,
And I try my best to to support, and to be real, and And I think patients, they don't, they obviously they hate their diagnosis, but I think that they appreciate that relationship.
It's definitely one of those things where, and again, like when I do speak to people who are going through a diagnosis, one of the things that I really try to hit home, especially in the beginning, is if you're with a doctor right now who you don't trust, you need to find another doctor. You need to switch gears. Like if you're in a situation with a doctor you don't trust, you're in bad news. That's just my
I think
personal.
that's fair.
I
I think
think
that's fair.
that that's number one. You got to find your guy, and make sure that that person makes sense for you. Um, and again, it's just one of those things that I admire. Why I'm pushing it is because I think that it's such a an admirable thing. And I guess that, if someone has to hear horrible news from somebody, it's nice that the person delivering it has a heart. And how do you leave that room? And again, the psychology of all of it is something that I'm wondering, how do you survive that psychology day in and day out? And then when you have someone like me in a situation like me, which you iterated is like kind of a best case scenario, people use very many times. I've heard the word lucky. You got lucky, which is counterintuitive because there's nothing lucky about getting a rare cancer. But I do understand what that means. What it means is that, this could be way worse news. And I do want to say one thing because I think that, as much as it is the doctor, it's also, there's so much for you as the patient that goes into it. And I remember, and it's just one thing I want to say is that after you issued my scans, I was waiting for you to come into the office to tell me. And I remember telling my father, who took me to the appointment with you, I felt like I was going to a fight, like in high school. Like I felt like I was showing up to fight the bully at high school. That's how I felt going to the where you were about to diagnose me and tell me what was my situation. And as I was sitting in your room, which is interesting because the office you always put me in was 33, in New Jersey, and that's my number. That's like, it was a big part of my journey was seeing that number everywhere. There were appointments with you that you walked into the room at 3:33. The room was 33. I mean, there was a lot of that happening. But as I was sitting in the room waiting for you to come in and diagnose me, I was sitting in the chair and I'm like, everything is good. Everything is good. And I was saying that over and over again. And I swear to God, Mark, you opened the door and before you even stepped in the room, you looked at me and you go, everything is good. I swear to God.
It's amazing.
You opened the door and literally said everything. And I was sitting there, everything is good. Everything is good. Do you think that on some level, because number one, I want to talk to you about surviving a diagnosis, right? And what's the best way to survive a diagnosis? But do you think that there is consciousness involved in this stuff? Do you think that a person's consciousness affects the outcome? Because you see this all day, and someone who's going into it and it's like, I'm going to die. I'm going to die. Do you think that person is increasing their chances versus the person who's saying, I'm going to survive?
It's a great question. I think that there are studies that show that people that are, and I don't remember the citation, but I believe there are studies that show that people that are very, very spiritual, religious, with the same diagnosis have a better outcome. Um, I don't know if I could distill it down to I'm going to survive, I'm going to survive, I'm going to survive has a better outcome than I'm going to die, I'm going to die, I'm going to die, because certainly there are people that are very spiritual, very religious that say I'm going to survive that have a very bad diagnosis and have a very bad outcome. I think people that are connected, whether that be spiritually, whether that be religiously, whether that be with their family, um, I think that people that are connected, in my mind, do better with respect to the process. I don't know with respect to the actual cancer outcome.
So I guess, just to summarize, so in your opinion, your consciousness is not going to necessarily affect the outcome.
I don't think so. Having seen a lot of people that are positive thinkers, spiritual, religious,
Didn't really find.
clergy who have not as great of an outcome, I have a hard time believing that. I mean, very bad things happen to very good people sometimes.
Okay. Well, one of the things I would also like to bring up is that, because I think that one of the things that's happening when people are diagnosed is they're looking for miracles, right?
Sure.
They're looking for those miracle stories, and in my opinion, I had several of them happen to me throughout my diagnosis. One of them was being initially diagnosed. and then re-diagnosed by Sloan and having a completely different diagnosis than the original one. So when I was diagnosed, I was issued paperwork that told me I had aggressive cancer. You re-diagnosed it and found out that I had the least aggressive cancer. How does something like that go like go between the radar?
Yeah, I mean, I think what you're getting at is the difference in pathology read, and there's sort of more aggressive types of the esthesioneuroblastoma and sort of lower grade esthesioneuroblastoma, and those are both associated with their own separate sets of prognosis, with obviously the lower grade having a better prognosis. I don't know how to answer the question of how did that happen. I just
Is it
know,
something you
and
experience?
yeah, I mean, we do have our pathologists are really, really wonderful here. And again, it's one of those things where when all you do is cancer all day long, you're going to be better whether you're, better isn't the right word. You're going to be more accurate with the final pathology, whether you're a radiologist or a pathologist or a surgeon. If all you do is one thing
Yeah.
all day, every day. But there have been multiple studies out of here and other big cancer centers like MD Anderson that show that the pathologist will sort of change the diagnosis when the slides get here in a relatively frequent number of patients because there's just so much experience. So it's not just the surgeon or the radiation oncologist or medical oncologist. It's also, the radiologist who sees things that others don't, or the pathologist who sees things that others don't, or the nurses that take care of cancer patients here. So that's why I've sort of said it to you before, not on the podcast, and I don't know if I've said it on here, is like just how fortunate I feel to work here because everyone is sort of dedicated to the same
Yeah.
mission.
I have to say that my experience with Sloan in general has been unlike any other doctor appointment or anything I've ever been to. And one of the things that's the most reassuring kind of things is that if your appointment is at 3 o'clock, you're being seen at 3 o'clock. That's been my experience.
Not always, but I actually what's interesting is that I think we try, but as you know, as we talked about, sometimes you can have a very hard conversation that can take a long time, or unexpected diagnosis, or a patient that you have to fit in. So sometimes my patients actually do wait pretty long. I'm lucky that we were lucky with you, but the reality is that I think for me the really wonderful part is that 99% of the patients understand when their appointment's delayed a little while because this is not a haircut.
Yeah.
This is sometimes involves a little bit more time and kind of understanding.
Yeah, no, for sure. My personal opinion, I would like to say that I
I just don't
found,
want it on record
yeah,
because
no, no, no,
I'd have a
no.
lot of patients that would disagree with
Yeah,
you.
no, I would say that my experience has been that they're very
Oh,
efficient,
great.
on time, with you in particular. Everything was
I'll
just
take
kind
it.
of right down the middle.
Thank you.
So I guess I would like to get into more of now, like, less, a little bit less personal. And my first question there would be, what is cancer and what causes it to grow?
That is a very, very, very interesting, challenging question that has evolved over time. Cancer is basically a group of rogue cells from your body, from any different cell type in your body, that grows in a different way and has the potential to spread either where it's growing or throughout the body.
So,
What the why is, there are many, many, many reasons why. I think the easiest sort of way to say it is there are a bunch of different risk factors, but we're not exactly sure why. Like for instance, why you had cancer. There's no why yet for you. Some people, like certain types of head and neck cancers or lung cancers, are from smoking. Not all, certain types. Certain types of head and neck cancers and cervical cancer is from something called human papillomavirus. Certain types of sinonasal cancer is from exposure to various environmental toxins like um, wood particles or dyes. But the short answer is that a lot of the time we have no idea. And the patient has no known exposure to developing that cancer.
Um, I think one of the things that we kind of know as the general public is, of things that we would hear, is that there's always cancer cells, dormant cancer cells inside of every single person. Is that true?
That is unclear. I mean, I don't know. I guess I can't say that it's true or not.
Right?
There
You've heard that
there
statement.
yeah, there is this concept of there are these kind of cells that are rogue and we don't exactly know how they're going to act. But that's a relatively new perspective, relatively new philosophy on it. And I'm not exactly sure. Most of the cancer, well, not most, a lot of the cancers have a typical transition pathway, like cervical cancer for women. You have a certain normal mucosa lining, and then there's a slight change, and there's a bigger change, and there's a bigger change, and you have cancer. You see that in tongue cancer also. It's normal tissue, then it's precancerous, then it's more precancerous, then it's site 2, and then it's squamous cell cancer. So there are a variety. I mean, there's so many different types of cancer. That's part of why it's actually impossible to have a silver bullet, because we can kind of find a cure for one type of cancer, but there are so many different types of other types of cancer.
It's like trying to cure a million different types of
Correct.
things under one umbrella.
Correct.
Yeah. How relevant do you think genetics actually are in people getting cancer?
Oh, amazingly relevant. I mean, probably the most important thing are the genetics of the individual, the genetics of the microenvironment. So in the sinonasal area, what's going on in there? What different types of bacteria or viruses are you exposed to? How does that interface? I think genetics are really, 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 really influential. We just don't know enough about that
So,
piece.
like, let's just say that my grandfather, he died of lung cancer. Um, One of I think my great aunt died from colon cancer. My grandfather had cancer 4 times, survived it 4 times. Had melanoma. What is the likelihood of, like, okay, my grandpa had cancer, I'm going to get cancer too? Like, what is the likelihood? Like,
We,
in
we,
your
we
opinion,
For certain cancers we know, for most cancers we don't.
it's a crapshoot.
It's a crapshoot. We
But it
don't.
does make
But
it.
in X amount of years from now, when science is advanced a bit more, we'll know much, much, much better. And who's at risk, and how do we follow them? How do we make sure that doesn't happen? But as of right now, your grandfather having melanoma, what impact that has on you developing thyroid cancer is ambiguous. We have no idea.
It's so interesting how much billions of dollars go into cancer research and all of this stuff, and we're still in a place where there is no silver bullet, like you said, and that there's still so many question marks around so much of it. And it's one of those things where you start asking yourself, like, is there more to it than just meets the eye? I mean, that's just my perspective, and I can take that perspective as a civilian.
More to it than meets the eye.
Yeah. I mean, I guess I don't want to get kind of like biblical on it, but is there some sort of aspect of judgment there, where again, I don't know if it's a great time to get into that kind of conversation, but
But I would argue quite the opposite. We spend lots of money on research, but we need to do more. We need to do more. We need to do more. We need to do better research to figure out, because we've made so many strides in so many different cancer types.
well, one of the things I remember
So
you
many different.
saying to me in the beginning too was that forget exactly how you worded it, but basically, this isn't the 70s. Like cancer is no longer a death sentence. That's what you told me. Something like that.
Yeah, your cancer definitely was not a death sentence. In fact, there's cancers that even 15 years ago would have had a very, very poor survival that now have a very good survival. Certain types of sinonasal cancers we do much, much better with. Melanoma, as you mentioned, that your grandfather had. If you had metastatic melanoma 15 years ago, that was a death sentence. Now we have immunotherapy that works in a large portion of patients with melanoma. So there've been so many advances, and there's such a better understanding, but we're not quite there yet, which is why we need to keep funding research and doing more as a society.
Outside of genetics, what would you say are some of the most cancer-causing things that people can do or be exposed
Okay,
to?
smoking. Smoking is still probably number one, two, and three, and then alcohol use is there's sort of data here and there about maybe one glass of wine is okay, but I think heavy alcohol use is a risk factor. I don't know. We don't really have the data yet, but I'm sure vaping is going to be found to be associated with certain different types of cancer because that's such a large number of people do that now. Um, there's just a lot of different types of things. Like as I said before, there's the human papillomavirus, um, which is causes cervical cancer and certain types of head and neck cancer. There is a vaccine for that. If you had a preteen, if they had the vaccine for it, the chance of getting head and neck cancer related to immune papillomavirus is basically zero. So there are things that we can do that we can prevent, and those are probably the human papillomavirus cancers in the head and neck are probably about 50% of head and neck cancers now. So we have made tremendous strides, um, and we do have the tools to prevent a lot of the cancers now. We just have to keep fighting.
Again, I know that I'm not trying to go in a too much of a spiritual direction, but I do have the questions, and I
Sure,
think a
of
lot of
course.
people being
You can ask
diagnosed.
whatever you want, and
Yeah,
if I'm not comfortable, I won't
yeah.
answer, or we could change the subject.
Um, do you think that cancer has a consciousness of its own?
I'm not sure I understand the.
So, do you think that, again, I'm trying to associate consciousness with cancer to some degree. And do you think, because again, it's basically something that's using you as a host, isn't it, essentially?
Sort of. I mean, I don't think
It's eating you, it's feeding off of
I'm
you. And
probably not smart enough to answer that the right way. I'm sure there's people that are colleagues of mine that can answer it in a much more eloquent way. I wouldn't say I don't think cancer has a consciousness in the way I think of having a consciousness of making decisions, but cancer does have its own genetic code, much like a parasite or something like that has its own genetic code, and that's why there are certain things, there's certain cancer types and um, certain cancers that if you treat a certain way, you can treat effectively based on the genetic code. But I wouldn't say that cancer has a consciousness. I don't quite.
I'm
I'm
not
not
saying,
evolved enough
well,
as a thinker or scientist
let me be
to.
a little bit more refined in that
Sure.
question, which is that, do you think that, um, well, I guess you already kind of answered it by saying, like, you don't think that someone's consciousness necessarily affects their diagnosis or their outcome. But my
No,
question,
so let's go back to that for a second. I don't think that it. I'm not saying that it doesn't. Someone's consciousness affects their outcome because I think if someone is positive, their overall general health can be better, and they can have a better support system, and they can adapt to things better, and they can get through treatment better, and they could do better. But I
so
wouldn't say.
it's going to make you survive.
But yeah, exactly. But I wouldn't
You're not
say
going to
it's
wish
not, it's not
away.
binary, and
Yeah.
certainly we don't have the data that we need.
I guess it was my questions were leading into what's the best way to survive a diagnosis, in your opinion? Obviously, the diagnosis is going to range from good news to terrible
I
news.
think
But what
surrounding yourself with a good team and getting to the most experienced cancer team that you can is probably the greatest predictor of best outcome.
so essentially, who are your doctors?
Yeah.
So surviving in your best way to survive cancer is to get yourself in front of the best doctors you can.
Yeah, I mean it's not that
Yeah,
it makes sense,
it
right?
makes
If
total
if you have
sense.
a hole in your roof, do you want the guy that replaces 20 roofs
Yeah.
a week, or do you want the guy that saw it once on YouTube? I mean, it's like I think it's where you're treated matters.
I mean, also kind of going back to this this thing where it's like when someone is diagnosed, they have in their head how they think it's going to kind of go, and even after you might tell somebody, "Hey, you're going to be okay." Like there's many times you told me those things, so you're going to be fine, you're going to be okay. Don't worry about it. Go home, chill out. You can't. Like you can't wrap your head around those
Of
things.
course.
And it's one of those things where no matter what. like even after hearing someone, you literally told me on two occasions, your cancer is cured. Which, what does that even really mean, was another question, because I think people are looking to hear that, right? I mean, that's the kind of the best news you can hear from your
Sure,
cancer doctor, is your
sure.
cancer's been cured. Because when you go and do research, it says that there is no cure. You can't be cured. So well, if you go on Google and you're looking up, like,
That's not true.
I think that it says more like, you have like it's like it lists you the 5 year, 10 year, 20 year kind of survival rates, but it's not like saying I'm cured for the rest of my life, right? Because there is reoccurrence.
Sure.
But is there a way that you could be sure that there's not going to be
No.
reoccurrence? There's no way to know that.
You could be, I mean, you could be cured and then have a recurrence down the road.
What's with the 5 year marker? Like what? Why?
Well, different cancers have been looked at and have different rates of recurrence at certain time points. So certain time points are important cutoffs for certain type of cancer.
So I mean, is that in 5 years seems to be, if there's no reoccurrence in five
For some
years?
cancers, it's 5 years. Some cancers, it's 10 years. Maybe for some cancers, it's even less.
Well,
It's very person and cancer specific, I'd say.
so when you're looking at those things again, so a person's going online, they're looking up their survival rate, right?
Yeah.
Which is something that I did.
Yeah.
What are we really supposed to be looking? Because that you do run into that 5 year percentage,
Sure.
right? Which is what I was kind of saying. I guess
Sure.
maybe I mis kind of quoted myself there, but when you're looking at that 5 year timeline, am I going to survive the 5 year? And people think like, okay, well, what about after the 5 years? Um, what can you just again, just wondering a little bit more about reoccurrence, because I think it's something that if you've been through cancer, you're always going to be thinking about that for the rest of your life, and it's going to be something scary to you for the rest of your life.
Yeah, and I think that unfortunately, there's no way to promise that that won't be a problem. Unfortunately, I mean, I think it's one of those things that when I say you're cured of cancer, that means that there's no evidence that there's cancer anywhere in your body. There's no evidence right now that there's any evidence. But does that mean that you won't have cancer come back down the road? There's no way for me to promise that, so I'm not going to. But if you look at the numbers at 5 years, I mean, you could ask ChatGPT right now at 5 years for a stage 1 or 2 esthesioneuroblastoma. That's Hyams grade 1. What's the likelihood that it recurs? They'll give you the numbers. It's really really low that it recurs, but it's a possibility.
Yeah, I think I remember you mentioning that, because for me to decide, we don't want to talk about cancer treatment now. But I
Yeah.
do remember, you telling me, hey, the reoccurrence rate in something like this after the surgery is going to be like 95% not going to happen. If you do the radiation, it's like 98%. It was just the radiation gave me a
Yeah.
literally only a 3%, but for me that mattered.
Yeah, for sure.
It's one of those things where I think anybody who goes through
It's
cancer
it's
treatment.
it's hard to wrap your head around, but it's almost like if your engine breaks and you bring it to the mechanic and the mechanic fixes your engine, unfortunately, there's no way to promise that your engine won't have a problem down the road. There's just no, or there's no way to promise that you won't have some other type of cancer down the road or some other problem. And again, as much as we want to promise that, we can't. And that's why we kind of try to support and be open and honest and be the team. Like, God forbid something does happen, then we'll take that as we need to take it.
Yeah. Well, I mean, part of what you guys are doing as a team here, right, is also, trying to figure out how do we treat whatever's going
Yeah.
on. Okay, so first we're going to do surgery. I remember also something you said, that if I was older, if I was like over like 65 or 70 or something, you wouldn't even do the surgery. You just have me go right to radiation. I said something to this degree. Like if I was much older, you wouldn't even recommend me getting surgery or something like that. I think you said
Maybe the other way around. Maybe we would get radiation for you if you were older.
wouldn't do
We would do
radiation.
radiation for you if you were older, maybe.
Maybe. But my question is that how do you decide what a treatment plan is? Because they were saying something when I was diagnosed with that, if it was had moved to a certain part or whatever, they were going to do chemotherapy for me, but then they decided not to give me chemotherapy, because chemotherapy was on the table for me at one point.
Yeah.
But then you guys decided not to give me chemo. because if apparently chemo wouldn't have helped my case either way.
Yeah, so there's certain sort of indications for chemotherapy in cancer care. In the head and neck, we'll give chemotherapy for really big tumors or for patients that have positive margins or for patients that have lymph node involvement. But typically for your type of cancer without those things, we wouldn't do that. We wouldn't push that. Now we have you meet the entire team, so you meet the medical oncologist and the radiation oncologist and me, and we would talk about it all. But
Mhm.
unless you have the absolute indications for it, because as you know, everything that we do to you has side effects, both acute as well as long term.
So what is chemo? Because I don't think people even receiving chemotherapy fully understand potentially what it actually is and what it's doing. Because I know people that are getting chemotherapy and they really don't even understand it.
Yeah, so chemotherapy just refers to anything that you get. Usually it's through an IV line, but sometimes it's through a pill that treats your cancer systemically throughout your body. So it's chemotherapy is something that you get again typically through your IV. The sort of older chemotherapeutics that are given, work in a variety of ways to kill cells that are growing fast typically, and that often involves sometimes killing some of the body's own normal cells like hair follicle cells and make your hair fall out, or stomach cells and make you nauseous and vomit and those kinds of things. So that's what chemotherapy is, and chemotherapy will again kill some of those cells if there are any cells that are cancerous. Now there are sort of newer types of chemotherapy like targeted agents that will impact certain types of mutations or changes that you only see in a cancer cell, or there's other types of systemic therapy called immunotherapy, and what that does is that will actually cause your body's immune system to fight cancer better. So it's actually relying on your own immune system to take down the cancer cells. So there's a variety of different sort of things under the umbrella of a medical oncologist, of which chemotherapy is kind of like a big catchphrase, but there are treatments now and have been in the past that work in a different way from surgery and radiation.
Yeah, I mean, I just feel like for the common person, they hear chemotherapy and it's terrifying. I know for me, the chemotherapy conversation was way scarier than the radiation conversation. And I don't know if that was just me or if that's kind of common with most people, but I wasn't as scared of the radiation as I was scared of the chemotherapy, just because we see these movies and the shows
Yeah,
and
it's definitely more in the cultural zeitgeist for sure, chemotherapy, the radiation.
right. And one of the things when I was going in for I received radiation. Actually, I received, I think, the maximum dose you can kind of receive. I got like 35 rounds.
I don't remember.
Yeah, 35 rounds of the maximum dose that you could get. Um, and I can tell you that, when I talked to you about it because I was scared, and I didn't really trust anybody but you, um, which I still feel that way. Again, it's not like a nod. It just, I felt like you were going to tell me the truth and not give me the whole manual.
Sure.
But I will say that, you told me you thought I was going to do very well with radiation, that I was going to have minimal side effects, and that, just to go through with it. That was part of your plan from the beginning. I remember after the surgery, coming out of the hospital and meeting with you with a follow-up conversation, you said that there could be microscopic tumor cells that are left behind, and you want to make sure you knock those things out if they are there, and that's why we're going to continue along the lines of this. But I will say that the conversations that go into the treatment plan before that, people calling you up and telling you what to expect and how to expect, and it is so stressful.
Of
Like,
course.
it is so, so stressful. And I know that it has to happen, but at the same time, it adds so much stress to the situation because what you're hearing is the worst case scenarios,
Sure.
right? You're hearing, hey, this is what can go wrong.
Sure.
And even if it's a small percentage that it's going to go wrong, and it's unlikely that it's going to go wrong.
Or even worse, hey, this is what can go wrong, and you could still have cancer when we're done.
Yeah, that was something that when I signed my
You
paperwork,
can go through all of this, and you could still have it when we're done.
yikes.
Yeah.
Yeah. When I was going to start my radiation, which I actually got proton radiation as opposed to photon
Yeah.
radiation, which I had to pay out of pocket for, by the way. my insurance wouldn't approve it because they said that the effect with the result would be the same.
Wow.
So my insurance wouldn't approve it, so I had to pay out of pocket.
Wow. Sorry to hear that.
No, it was very expensive. It was over six figures.
Wow.
But I paid out of pocket because I was told that this is with this and this and this and this is your best way to go. And I was like, all right, I mean, I have so much responsibility in my life. I didn't want to roll any dice, so I did pay out of pocket. They gave me a discount. They gave me a discount. Pay with cash. So I was talking about radiation, and I remember when I was going for my first, like they're fitting you for the mask and things like that. And it's very scary. Like when you're getting fitted for that mask, it's also very uncomfortable.
Mm-hmm.
But I do remember signing a piece. One, they wanted me to, they didn't want me. They were asking me if I was willing to, because I had such a rare cancer that they wanted to do studies or follow-ups and all these other things with me. I wasn't even sure. I said no. I was like, like I don't know why. If I could go back in time, I would say yes. I'm sure you hear that quite.
You were.
I was just scared.
nervous.
I was
Yeah.
scared, and like I didn't want to talk about it another second than I had to.
Sure.
But if I could go back in time, I would have done it. If you can, I wish I could go back in time, but you can't. Radiation essentially is what? And can you tell us the difference between proton and photon and
So radiation is basically taking advantage of energy to destroy tissue. Now, the radiation therapist and the radiation oncologist are really wonderful, amazing at looking at scans and seeing where the cancer is and where the normal tissue is and targeting the specific area where the cancer is for optimal dose of that energy. The difference, I'm not a radiation oncologist, so take it with a grain of salt, and maybe you could talk to Dr. Lee or another radiation oncologist, but protons and photons are just two different types of particles. And protons have a sort of decreased geographic
they're more
region,
precise.
right? Decreased region that gets the high dose of radiation. So at least theoretically, there's a decreased risk of having the radiation go to the wrong areas.
Yeah. Well, one of the things that I thought was really interesting is that when I was going through radiation, again, I had 35 rounds, 5 days a week for, I guess that's 7 weeks, right? You get the weekends off. But I did run into people who were getting 3 rounds, 4 rounds, 5 rounds, and I was like, well, what's the point? Why am I getting 35 and they're getting 3 or 4?
It's different depending on the cancer type.
But what could 3 rounds of radiation do? Like
some different types of cancer and different types in the body get less rounds at a higher dosage typically.
Mm-hmm.
Just different.
Yeah. Well, I will say that, because a lot of people are getting both, right? Chemotherapy and radiation. And again, I didn't personally go through chemotherapy, thank God, because I was terrified when they started talking to me about it. But I did go through radiation in an intense way. I do think that it was a lot. I don't know, in my personal opinion, again, you have to trust your doctors. Your doctors tell you something, you got to trust them. If you're not going to trust your doctor and listen to your doctor, you're with the wrong doctor. And that's my opinion. I remember when I got to around like 2021, I was breezing through. I know you don't remember, but my first round, my saliva glands blew up like a puffer fish, and I was freaking out because I'm like, this is only round one.
Yeah.
But then it went down and nothing happened after that, which was so strange to me. But my first round of radiation, I think it was my saliva glands. They just blew up, and I had like goiter sticking out both sides of my neck, and it was terrifying because I was like, this is round one. I got 34 more to go. Like, what is this gonna? But you told me just it's okay, and that went down and then didn't reoccur. That's another question that I had. I guess a more personal question, but how was it that the first round did that to me, and then it just went down and was normal after? It didn't happen again. Is that something you see before?
Yeah, I'm not exactly sure.
Well, you're not a radiologist, right?
You can get kind of sort of when you're dehydrated or if you have a stone or something, you get sort of your saliva glands or submandibular glands could swell. I don't know why it happened to happen after the first one. It may have just been a coincidence. You may have been dehydrated based on something else. Not
So
sure.
up to round 20, blew through it. Outside of the first day when my saliva glands blew up on me. But up to round 20, like nothing. I was like,
Yeah,
man, this is easy,
it's very
boo.
common.
This is easy stuff. You know, I was showing up.
26.
Round 21, I think it was 21 or
Yep.
22. I'm driving home, and that's when my beard started falling out. And then I woke up the next morning, and I felt like the taste in my mouth had completely changed.
Huh.
It tasted like sucking on like old metal, and I
Huh.
couldn't eat anything. And they had told me that if I dropped down to 155 pounds, they were going to put a feeding tube in me. I finished radiation at 156 pounds. Right now, I'm walking around to like 180, but I was 156
It's
pounds.
tough.
Yeah, man. It's a very tough subject. Like even talking about it and not I'm trying to stay like disconnected from the subject, but you know, it's just like it brings back these things and like you're just never the same again. Like you just can't go backwards. But you do have to trust your doctor and you have to listen to your doctor and do what they say. If I could go back in time personally, I think I would still do the radiation.
You would.
I think I'd still do it. You know, the side effects that I experienced from it, and it's just something that I want to talk about it a little bit because
Sure.
like there is no information. Um, I will say that again, mine is also specific to the head and neck. I got my set of lymph nodes right here in the front of the
Yep.
neck, right, which I'll never grow hair there again, right? And I also got this whole area,
Yeah, I got red.
yeah. Never horrible. I mean, it was like it was like a spray tan
Hmm.
in that area. And then I also lost the top of my mustache. But I don't know anything outside of head and neck radiation. But I will say that, you know, the long-term effects of it are dry mouth. You know, that's one thing that sucks. Especially in the winters. The winter's way harder than any other season for me personally. So also getting those nosebleeds, you
Yep.
know, the nosebleeds are rough. Wood neck, you
Yep.
get your neck just locks up on you and it's horrible. Um, but outside of that, it's really not that terrible. I mean, I got to clean my nose every single day, but I don't think radiation is. I was going to be doing that kind of anyway, right after surgery.
Maybe, maybe not.
But every day I'm doing nearly rinse, maybe once or twice a day. I don't. I'm always walking around like because all of the mucus and stuff just goes right to the back of my throat, so I don't process it. But what would you say to someone who's, because I know a couple of people who are resisting treatment because they're scared of it or whatnot? Like how do you explain that to someone when they're like, I don't know if you experience it. Are you telling people, hey, this is the treatment that you need, and they're like, no, I don't want to do it.
Yeah, I think the number one thing is I'd encourage them to talk to their doctors about it, about what specifically their concern is and why there's concern, and ask the doctors what the ramifications are of not doing that specific treatment. Again, as we talked about before, this idea of thinking about and talking about what matters most to patients, if it's a 5% difference in chances of recurrence, and the patient says, I'm okay with that, I don't want all those other possible things, then the patient is a part of the decision making process. But what I really is the saddest thing for me is when you have a patient that doesn't engage the doctor with it and just kind of disappears and then comes back a year later with family and friends, and it's a situation that was treatable before and isn't anymore. So I would encourage anyone that is in that situation to talk to their physician, talk to their nurse, figure out what's going on. Don't go get into a what's that rabbit hole or whatever it is on the internet of alternative remedies that are not proven. And if you don't like what your doctor has to say, consider getting another opinion.
You know, I remember one of the things that
And if your doctor is mad that you're getting another opinion, that's probably not the right doctor for you.
yeah, I do remember that the person who handled my radiation told me because I was trying to negotiate. I was like, well, what if we only do like this? But they said the first time is the best time.
Mhm.
Can you explain that like a little bit more, like what that actually means? That what does it mean the first time is the best time?
Yeah, I mean, because if you come up short and the cancer comes back, it may not be possible to beat it. So
Why is it easier to beat cancer the first time? Or is that an accurate statement
yeah,
even?
yeah, for sure. If a cancer has recurred, it's harder to treat the second time.
Why is that?
And if you argue or negotiate for less radiation and the cancer comes back, there are limits to the radiation, then you can't go and give the 70 gray of radiation anymore because your body already had 56 or 60. So where you are treated and how you are treated the first time you have a cancer is definitely what's most important. That's not to say that if you have a recurrence, there's no treatment for it. It's just sometimes a little bit more challenging than the first time. So it's definitely true.
Yeah, and so I mean, I think that that's really like what you were talking about, that 5%, that 3%, it sounds like such a small percentage and it sounds like such a small margin,
Yeah.
but it
Not if
does.
you're that percent. Well,
Yes.
that's what when I talk to patients and their patients sometimes will be fixated on percentages. And I'll give the best guess of what the percentage is, but I'll say, if there's a 90% chance of cure, but you're one of the 10% that's not cured, what does that 90% actually mean to you in your life? Right? It doesn't matter 90% chance of cure, but you're one of the 10% that didn't get cured. So the percentages are helpful, but they don't tell the whole story.
Do you think that there will ever be, like, I love the word you use, silver bullet. And I don't know if that's a term that you guys use here at the hospital or if that's just your own personal term, but it's a great term for it. Do you think there will ever be like something that just cures cancer?
I don't think there'll be a one cure for cancer, but I think that there'll be lots of different cures for lots of different types of cancers.
What would you say is the difference in the way cancer is treated now versus, let's just go back a couple decades? So if you can just kind of say, okay, in 1990 or 2000, 2010, 2020, how far has the research taken
Well, it
us?
depends on which cancer we're talking about. So if we're talking about, say, your cancer, for instance, you're talking about a difference in making the cuts on the face and the cuts on the head surgically. You're talking about a difference of having a much narrower field of radiation from IMRT or the best in photon radiation. Before that, it was much, much more scattered to IMRT and then to proton radiation. And then with respect to the chemotherapy, we have targeted agents, we have immunotherapy, we have a lot more tools in our toolbox that lead to better outcomes and to worse side effects. But there are certain cancers that have been tremendously impacted by radiation. There are certain types of lymphoma that there is a silver bullet for that type of lymphoma. There are certain types of melanoma, again, as I said before, that you'd have 20-year-olds dying of metastatic melanoma, whereas now we give them immunotherapy and they're not. And then there's other types of cancers that haven't moved quite as much, like certain types of brain cancers that the survival is maybe a little bit better, but not as much better as it should be for different types of brain cancer. So I think it's cancer specific, which is why I say, 20 years from now or 30 years from now, things will be so much further along, but it'll be different by different cancer type. And what I see in 30 years is I see genetics, as we talked about before, playing a much greater role. So a
And like,
patient's genetics
mhm.
will be predictive of how they'll respond to different types of treatment. So you could say maybe treatment X will be better for patient A and treatment Y will be better for patient B. The treatment, C, which we don't have to give more than 50 gray, will be okay for this patient. Like, I think it'll be individualized. I think it'll be patient specific care, which is really the sort of the goal of all of it is to be able to say, patient A, this is the best treatment for you. Patient B, this is the best treatment for you. Not hitting everyone with a hammer.
I refer to, like, when people ask me about Sloan in particular. Um, I like to say that you guys threw the kitchen sink at it, um, which is what I would prefer. Actually, I just say again, it's one of those things where I think people who are, it's number one, being diagnosed with cancer. You've never been diagnosed with cancer, right? Thank God, right? But like, even you who operates on cancer every single day and has these conversations every single day, I I don't imagine that you know what it's like to receive a cancer diagnosis yourself. because you just can't. It's like having a child. There's no way to describe to somebody what it's like to have a child. The only way to know what it's like is to have a child. And I think cancer is the same kind of thing. And I think that that's why it's so important for people to get support and to talk to people who have been through it.
Sure.
Not just your doctor, but people who friends who have survived cancer, especially. I think is so important. But I guess that my question here for you is that in the process of being terrified of all of this stuff and not knowing what's coming down the line, and is there any kind of support you would recommend outside of having conversations with your doctor? What does a person do on their off time?
Yeah.
Like I'm not in front of you, I don't have access to you today at this moment, and I want to talk to you. What does a person do?
It's a good question. I think the first thing is, and I want, it's a multi-layered answer. I think the first thing is knowing yourself and talking to your doctor and asking what type of resources the doctor knows of. I think if you're someone that would benefit in talking to a social worker or a psychologist, there are those resources out there, and here we try really hard to connect people to the right folks if you need it. And sometimes you have to be more vocal about needing it, and sometimes you have to be less. You don't have to be as vocal. I do think that there is a deficit here. I do think, and this is one of the organizations that I'm really involved with, the American Head and Neck Society, sort of on the executive team for the skull base section. And one of the things that we've identified, I'm the chair of what they call the Patient Advocacy Committee, is that we've identified that there are deficits, especially for sinonasal cancer patients, whereas certain types of cancer out there have really, really robust support systems. So there's something called the Chordoma Society, the Chordoma Foundation. And if you have a chordoma, which is a different type of skull-based tumor, there's tremendous resources for you to call and to talk to someone and get connected with someone. But that's not really the situation for other types of cancer, especially for the other sinonasal types of cancer. So one of the things that we're actually trying to do is figure out how to do that better. So we've discussed with the Chordoma Foundation, we've discussed with other groups how we can best replicate that in sinonasal cancers. The problem is sinonasal cancers are rare, as you know, and they're so heterogeneous, meaning your pathology is different from some other pathology, which is different from some other pathology. So your challenges and your anxieties are different. And the question is, how do we best put together, how do we connect people that could help other people, and how do we do the best good for people that are getting diagnosed this way? And this is something that we're actively working on, trying to figure that out. So we could talk offline and what your thoughts are about that also.
Yeah.
We actually are publishing in two kind of lay journals for physicians how to best support their patients and what the opportunities are there.
I think the major issue there, and I'm going to speak for anybody who's gone through cancer, is really that your toe hurt. You wake up in the morning and your toe hurts. Your mind immediately goes cancer, right? I have stomach ache. Like recently, I had stomach problems. I took several rounds of doxycycline, destroyed my stomach, and I'm thinking I have cancer in my stomach.
Yeah.
This is where your mind goes after that. Like, there's no way for you to not go into a place of like, is this cancer? And it becomes like this monster under the bed, essentially. And one of the things that I've thought about for quite a few years now, and why I finally got the guts to talk to you about having this interview, is like, I think that information is just so important. And that's bringing me back to the major point here, which is that the lack of information that we have from doctors, not unlike yourself, leads us to listening to holistic doctors on YouTube or TikTok or whoever it may be. And then you wind up in a situation where you're kind of negating traditional medicine and going in the direction of like all of these other things. I think both need to happen. I think that traditional medicine. I think like if your doctor is telling you you need chemo and you need chemo and you need radiation, and that's just the end of the story. Swallow it and suck it up and do what you got to do. As brutal and as scary as it is. Um, but I also think on the other side of it, you need to be doing work yourself because okay, maybe it didn't work that I fasted, or maybe it didn't work that I did this, but you're putting it into your head that you're doing something and that you are fighting. And I think that that's something really important is to give people tools on how they can be fighting outside of the traditional medicine world, even on a psychological level. But I think even more importantly is having doctors like yourself who are willing to say things that most doctors aren't willing to say to their patients, who are not looking to be like, hello, friend. That goes such a long way. I don't know if you know that and you do that purposefully, but it's like it removes that like edge right off the bat. And I noticed that you do that right out the gate. You're like, hey, friend, how are you? So nice to see you. And it turns it into less of a like this kind of like are you going to see something in my nose today, and more into like okay, I can kind of relax a little bit, and I think that educating doctors in that direction on
Yeah.
bedside manner is one of the most important things, and I don't know if you can lead and
No, well, I mean, thank you for saying that. It means, as we said before, it means a lot that you mention that, you bring up that. I mean, with respect to the other stuff, I mean, the other piece too is that the patient, should really kind of know themselves and if they need to talk to someone, and I think everyone kind of needs support. And I don't exactly know how we could unify these both of these issues, but I'd encourage people to talk to someone, whether it be a social worker, a psychologist, psychiatrist, friend, someone. I think when people are feeling alone, that's the hardest part. And I don't know exactly how we support that for all cancer patients, but we do have resources here at MSK, and there are other resources that we could tap into. But I think having someone to connect with is critically important.
well, I think also going back now and like we can end this kind of conversation.
Sure.
We can end the conversation on this idea, which is
Sure.
the people's perception of doctors, and um, I think that one, bedside manner plays a large part in that. I think that when
Agree.
people are scared, they're looking for comfort. And I know it's not the doctor's job to give anybody comfort, but at the same
It is.
time,
I'd argue that it is, but yeah, I'd argue that comfort's an important part of the job.
is that something that you're taught in medical school?
Yeah, I mean, to a certain extent, and I think it's there's more awareness now that needs to be taught more than when I was there. But there was a course when I was in medical school on that.
I wonder how like we can, because again, like I said, I ran into doctors that told me all the worst case scenarios, things that probably weren't even really relevant to me whatsoever, things that you never told me, or things that I didn't need to probably know. But once those seeds are planted in somebody's head, there's no way to get those seeds out of your head. I mean, I was told stuff 5 years ago that I still remember to this day, that still scare me to this day, that may never be relevant to me. And actually, me knowing that stuff is not beneficial because it's something you would find on a scan down the road anyway, right? I mean, like, I don't need to know that
Yeah,
today. So I think that that's something that's like really relevant as well is how do we hand out and disseminate information to people who are recently diagnosed when they're already like stress level 10? Um, how do we decrease that stress level? I mean, again, that's part of my thinking anyway, is what can the doctors who you're talking to do? Because listen, the truth of the matter is that running into a doctor like you, and I know what you're saying, and I know that like your side of the fence is your side of the fence, but to run into somebody like you is not a dime a dozen. It's a rare occur. In my opinion, it's a rare occurrence. Um, I wish that that was more of a common occurrence for people. There's people who have gone. One of my best friends, she had a surgery done on an army base. They destroyed her for the
no,
rest
I'm
of her.
so sorry.
Yeah, she has to get it like hard destroyed her. Botched surgery, destroyed. How do you think she feels? For the rest of her life. How many friends that I know that Another friend of mine who had surgery and it went terribly wrong, and it's kind of what I was saying to you before is that like you're putting yourself in this position where all the responsibility of this, you're taking a person's life and putting all the responsibility on your chest from diagnosing to treating. And it's just like, I wish people had more respect for that perspective as well. But I think that it's very easy for people who are not doctors to go in that direction where I think doctors can also feel underappreciated,
Sure.
where I don't know that you're researching my case outside of when I saw you. I don't know what you're doing for me and my case outside of what I know. You never say, hey, listen, Chris, you know what? I spent 5 hours the other day researching your case and trying to figure out how I'm going to do this. How much prep goes into you figuring out a surgery? What
Yeah.
does that even involve? What is that like? For us, we like, oh, I'm going to surgery at 2 o'clock and I'm done at 5. But for you, it's not 2 to 5, is it?
No. No, I think you're hitting on a lot of really, really important topics. I think realistically, I think the 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 piece that's tough is that one, I think that there is, how do I want to frame this? Um, I think that, as we talked about before, I think, physicians by and large are, at least the ones that I know, are trying their best under a variety of circumstances. The physicians that I sort of I know and I work with really have dedicated themselves to their patients, um, and the pursuit of curing cancer. I certainly think that there is a need for sort of better engagement, better opportunities, better communication, but it's really, really, really tricky. I mean, even going back, and again, your experience, I think when as I told you before, on the sort of spectrum of how people do, is on the far end of like done great. You look great, you'd never know. You're an amazing ambassador for people that have cancer. Like I look at you as one of really the real success stories. Um, and most of our patients that have what you have the same experience, and I'm really happy and proud of our program, and happy and proud to take care of patients like you, and to take care of patients that have different challenges and different problems. I think the hard part is that with limited resources, how do we relay all the possibilities to patients? So the physician that relayed to you all these things that never came true, you could see a world where if that came true to someone else and they didn't relay that to them, how they'd be upset, and how they would have felt bamboozled that they never were aware that this could happen. You understand what I'm saying? So
Yeah,
and again, I think some of it is how it's framed
but
and how it's
again,
communicated,
what you said
and I
too.
think at the end of the day, the most important part is the relationship, which is sort of goes back to the very beginning. If I'm very, very proud to do what I do. And if for patients out there that have a bad diagnosis, or a good diagnosis, or any diagnosis, whether that be cancer or not, if you don't feel like your doctor is your teammate and your partner to go to battle with, then you should get another opinion, because you
Yeah.
should find your people, as you sort of said, because you don't want to look back and say, if only I had done something different.
I think that like kind of what you were saying too is that one of the things I really liked is that it should be the patients also involved in the decision making as
Totally.
well. And I think that an option, again, hey, how are you today? I'm great. Okay. Would you like me to list off all of the possible complications that can come with this? No, I don't want you to. Okay, can you sign a waiver that says you are refusing to hear the 100 terrible
Sure.
things I'm about to tell you? Yes, I would love to sign that waiver. I think that something like that is, also an option that, why do I have to know something that I don't want to know?
Sure. No, and
Um,
this is also part of what we say, like a patient-centric approach. The patient's the middle, patient's most important. This is what's really critically important, and what we try to teach our trainees, and what I hope the next generation of doctors sort of take with them, is that at the end of the day, it's all about the patient, and I guess that's sort of where I probably would end. That at the end of the day, I'm elated that you're doing so great and you're working to advocate for patients that are going through what you went through. And even you with a team that you really appreciate, you had challenges, and you're using your experience to help others. So I'm grateful for that.
Yeah,
Thank you.
I think looking back on the whole process, I think that I was really lucky, and I think lucky is the right word here, but I also think it's the wrong word because I also think that I was put in the hands of people like yourself, primarily you. I mean, again, I know you want to credit. I don't see who's in the room. I see you walk in the room and tell me, "Hey, you're not dying." So I do have an endless and there's nothing I could ever do to express my appreciation for you. And um, I just wanted to say one thing to you, which is that over the weekend I was at a resort and I saw this show with a guy who's a mentalist, and he passed out these little pieces of paper all over the room, and he said, I want you to write down the name of a person who is the most important person to you outside of your immediate family. And your name was the name that I put on that piece of paper.
Wow, thank
He
you.
didn't pick me. Okay, I'm sure that there was a reason why I didn't get picked. Um, but your name was on that piece of paper for me. So out of all the people I can think of in my life, that is, you
Wow.
are like the most important person in my life out of anybody that I've ever met outside of my immediate relatives. And I don't know how that feels to hear that from people, but I'm sure I'm not the only one that feels that way. Um, and I think that there's people out there who are in a situation that is not working for them and they're stuck in that situation. And I just wish that people would have the strength to get away from a situation that's not working for them. I already started with this person. I'm going to feel like just because you started somewhere
Yeah.
doesn't mean you have to finish there. And I started somewhere too, and I wound up finishing with you. Um, and you weren't the first person I talked to. You were the last person I talked to. And for me, to hear somebody say, "I'm going to get this out of you," like that was one of the most life changing statements I've ever heard in my life. And I believed you. And I didn't think you would say that to me if you didn't really believe that yourself. Um, it was a perfect thing to say. I feel like we're at the end of it, but there's just two other topics that I really think are
Sure.
important. One
Of
is
course.
catching cancer early. I think that it's just so common for a person to prolong getting checked out
Yeah.
because they're scared of what they're going to find out. Isn't that the
Yeah, that's a part of it for sure. Is that people need to see their primary doctors. People need, if they have something that they think is not right, they need to get it checked out.
what do you do about that psychology though? Like, I mean, even for me, I was having the stomach problems and I was like thinking of every way, how do I not really get this checked out? Because you're so terrified of what the answer could be. But at the same time, I've learned over the years that as terrified as I am of what maybe a diagnosis may be or what I have going wrong, if it's better for me the earlier I catch it,
Totally.
the better the prognosis is going to be. So I think it's one of those things I wish I could encourage people. Like, if something's wrong, just go get it
Yeah,
checked out
I agree.
now, because either way, if there's something wrong, it's not just going to go away on its own. It's only going to get worse. And do you have any thoughts or
Yeah, for
anything?
sure. I mean, if there's any question, if you're unsure about something, just see your doctor. See your doctor. That's it.
No one's going to listen to that though. People don't listen. People are not going to like people. I mean, is there,
And if your doctor's not listening to you, see a different doctor.
how do you have a thought on how someone tackles it early? Like, how do we get to the table early? How do you even know? Because sometimes you don't even know something's wrong
I
with
mean,
you.
for you, you wouldn't know.
I had a stuffy nose,
Yeah.
and I was told and told and told that
You
it was.
don't. I mean, I think the key thing is to get, in the absence of symptoms. If you have a symptom of something, then you should not let that go. You should see the appropriate physician. If you have a stomach ache, you should see your primary doctor and say, "I've had a stomach ache." If you have bleeding from your behind, you should see a GI doctor or your primary care doctor. If you feel a lump in your scrotum, then you should tell your doctor. If you feel something in your breast, in the absence of symptoms like that, you should get the normal screening things like a mammogram when you're a certain age or a colonoscopy when you're a certain age, things that have been shown to decrease your risk of dying of cancer. Um, and I hope that patients are empowered to go to see their doctors, and I hope that patients are empowered to see their doctors regularly. And really, that's the number one thing to stay healthy.
You know, I asked you at one point when I was going through everything if you believed in miracles, and you said you did believe in miracles, and I was wondering if you wouldn't mind explaining why you believe in miracles, because you did say you did believe in the miracle.
I believe miracles.
Have you seen miracles?
I don't exactly know how I would define miracles. I mean, I see miracles all the time in someone who has a very bad diagnosis but behaves in a certain way and is so positive and full of life and light. Um, Certainly things happen that you kind of look and you say, wow, that was amazing. I have no explanation for that, whether that be in medicine or with my family or something else like that. Um, I don't know. To be honest, you're hitting on topics that are outside of what I think about very frequently, which is my own issue.
Well, I mean, again, it's two completely different perspectives. I don't have to wake up in the morning and put on latex gloves and go take cancer out of people, you know. So it's easy for me to sit back and backseat drive to some degree. But I was wondering if I could ask you. I don't know if you're allowed to talk about it or not, but do you have like one particular story that sticks out to you, kind of like that you were like in the beginning going into it, you were like, this is going to be a tough win, and then wound up being a win. I guess what I'm looking for is that, like, hey, I'm out there, I've been diagnosed with this. It's horrible news, but it's possible to win.
Yes, that's happened for sure, more than once.
Is there one particular instance that maybe you could kind of
Mm.
generally talk about?
Yeah, I mean there are definitely multiple instances of patients having a specific problem with a very, very, very poor prognosis. And miraculously, if you will, responding to a treatment that we never thought would work. Young people that then go on to go to college and graduate school and do things that are amazing.
What do you think the general
And there's multiple ways to think about it, right? One could say that was definitely a miracle. One could say that tumor had a certain mutation that would respond to that therapy that we gave. It's all a matter of your perspective. But that's actually what I think is so wonderful about what I do is that you can see kind of things and see them as just another day at the office or miracles.
I mean, obviously you can't really talk about it in depth, but I would say, like, when you first meet with someone, like when you first met
Yeah.
with me and you hear it, like, do you play out the whole scenario early on in your own head?
In my own head for sure.
And how open would you, I mean, you can't tell somebody, "Hey, you're gonna be fine," until the scans show up,
No,
right?
I mean I say that um this is typically a very aggressive type of cancer and I will give numbers. But again, much like I said before, no one wants to hear that it's a 90% chance of cure and then be when they're the 10% that failed, right? Like if someone has a recurrence, you don't say, oh wow, 90% of people that had what you had didn't have a recurrence and you're one of the 10%. It's the same. It's the same as the other way around. If 90% of people fail, but you're the 10% that is cured, I mean, everyone, that's why it doesn't, the numbers don't mean anything if you're the person that does really well with a bad disease or you're the person that does not as well with a favorable problem.
Would you say that it's more likely for somebody who's been diagnosed with cancer to get a second diagnosis in life? Is it make you, like, higher.
Second diagnosis of cancer,
Yeah.
certainly.
So
Well, and but it's a little bit confusing. So it used to be that people with head and neck cancer had a higher risk of having lung cancer, but really it's because a lot of them had risk factors like smoking and drinking, or they're getting scanned a lot more. Um, but to say like a blanket statement like you have a higher risk of getting cancer than someone else, I don't think I can make that statement
So just
for you
because,
personally.
well, in a general sense, just because someone has cancer once doesn't necessarily put them on a much higher
Correct.
trajectory for
Depending on
getting.
what the cancer was and what their risk factors were and how they were treated and those kinds of things, but generally no.
So I guess for someone like out there who might be listening to this right now who's going through cancer, just because you had cancer once doesn't mean you're going to get it twice.
Correct.
Doesn't mean that you're for the rest of your life you need to be looking over your shoulder and waiting for the second time to come.
That's 100%.
Yeah, because I will say that that's the greatest challenge for someone who goes through cancer. I don't think you ever beat it, you know.
Sure. And
Um,
that's the important part of support system of having someone to talk to, professional to talk to about these kinds of things.
yeah, I think that that is the major point of this whole conversation. Um, just to wrap it up, I really have no more questions. I think we really that was a lot, and I thank you
So,
for
of
going
course, thank you.
a lot. If you had one piece of advice to give anybody, not
Um,
even regarding cancer, just
one piece of advice to give anybody.
if you were looking at one of your kids and they said, "Give me one piece of advice," and you only had one piece of advice to hand out,
I think it's follow what you're passionate about. Do what you think you're passionate about. For me personally, I really am very passionate about taking care of people that have this ailment. And there are ups and downs in what I do for sure, but it's really, really it's an amazing thing for me. It's the key to, other than my family, it's been kind of the key to my happiness and whatnot. I think that following your passion and being kind. It's really, it never hurts to be kind, ever.
do you have? I just getting so another
Please.
question popped into my. Do you have a way of not allowing I guess losses? Again, for me, I'm considering like a win versus a loss is in your world. We got the best outcome versus this is we got the worst outcome. But what tools do you have as a doctor? Because we're always so focused on the patient, but also getting into the head of the doctor. What tools do you have for dealing with losses where, like you said, you're working on children, you're working on mothers and fathers and people who are putting all their eggs in your basket. Dude, that's why I've always told you, and I will continue telling you my respect for you and what you do and the risk that you take and putting yourself in that position. I don't know.
Well, thank you. I think that much like we talked about for patients going through things, I think the key to getting through and to enjoying what you do, but also dealing with the wins and losses, as you say, is having a support system, having mentors that you can talk to, having colleagues that you can go through things, having people that you work with that can come and help you with an operation and you can help them with an operation, and just doing it with a community.
Have you ever felt like you needed a break?
Um, like I need a vacation because I'm tired sometimes, but not really like I want to leave the field or I need to be separated.
I don't want to do this anymore. You've never had that moment?
Even when things are really, really bad and you have a really poor outcome, not really. Because the reality is that I've been very, very blessed to have people that really support me and care about me in my life, both in the hospital, outside the hospital, but really in the hospital. When you have people that care about you and support you and are aware of what you're going through, and they call and say, "Hey, you're a tremendous asset," or "Hey, you're doing amazingly good things," or "Hey, you do," one of my mentors would say, if you do big operations, sometimes you have big complications. I mean, otherwise, like that's part of the deal. That's part of the privilege that you get to see people through a journey. Um, and I think the support of people around me has prevented me from saying I want to retire or something like that. I think that I've been blessed that way.
Well, you're still relatively young, right?
Yeah,
What are you like in your early 40s? Am I
yeah.
allowed to ask you that?
Later 40s. Yeah, later 40s.
How does it feel when you run into someone like myself, like maybe who's like in the same kind of age group as you, or maybe someone who you might even, like you said, have a beer with on the outside of this whole situation? Like, what is that like to run into like a person you kind of relate to, I guess?
I find it rewarding. I mean, I've gone to see a few of my patients play live music. They've invited me to shows. I've gone to a patient's wedding. I mean, I go to things, I hang out, I find it's amazing when I can be a part of a patient's journey beyond their cancer. Actually, that's like an amazingly inspiring thing for me.
I think that that's something that we don't expect. Like, and that's kind of what I was trying to tell you before. Like you look at it like, hey, you're a person, I'm a person. But I think when, y- for the patient, you look at the doctor as not a normal person.
Yeah.
Like I've seen people talk to I will tell you, one of my best friends is an ER doctor, and you see people talking to him, and you're like, I know this guy outside of here. You know what I mean? He's just a normal person, but at the same time, the stakes are just so high. Again, my respect for you is endless. I love you, dude.
I love you too. Thank you.
Um,
This is awesome.
I hope that, people have at least this now when they're looking for that situation. And I will say that, again, I know these are not your words, but I will say that my process of being diagnosed and just being slapped in the face with it, literally, it's this like surreal moment of hearing you have cancer. And it's the last thing you expect. Like you just don't expect it. So it's going to be a hard smack when it comes. Um, I think that even if you are the type of person that is prone to stress and anxiety, you need to get your shit together and you need to go find your doctor. And that's what needs to happen first and foremost. Go find your doctor. I don't think you need to get into the headspace of this is a death sentence.
Yep.
I think you need to get a diagnosis from a doctor. I think going in the direction of this is a death sentence right off the bat is the wrong move to make. I think yes, you're going to be scared out of your mind, but going in the direction of this is a death sentence will affect your ability to move forward in your treatment. So I would say that, like, the one thing as being a cancer survivor myself is that my one piece of advice would be just because you've been diagnosed with cancer doesn't mean you're going to die. And I think that you need to hear that, and I think you need to know that. And I know people who have been diagnosed with stage 4 cancers. I'm sure so have you, and they're cancer free right now. So just because you hear something bad, it doesn't necessarily also mean that you're not going to make it. I think that for me personally, consciousness does make a huge difference. I think that you can will things into existence if you're able to get past the terror and the fear of all of these things. I think remaining positive, staying strong, trusting your doctor, having a doctor like you who's willing to answer a phone call, who's willing to call the patient themselves. I've received 5 phone calls from you personally that you didn't need to make. I know that you didn't need to make those phone calls, and I did receive 5 phone calls from you personally. Um, and you didn't need to make those phone calls. You could have had your nurse or your NP make those calls, but you made them yourself. And yeah, man, love
Thank
you.
you.
Thank you. Thank you.